All right, let's make your back stronger and pain-free. Why is that important? Why do you want a stronger back? Why do you want a pain-free back? Why is that?
So we can walk.
Yes, you can walk around, move, and not be grouchy and mad. You know? When you're in pain, you're like, ugh. Pain long enough, become like grouchy. And then sometimes what happens, some people, as you guys know too, when you're in pain long enough, then you also get sometimes anxious or depressed or just feel overly stressed. So can I help you reduce that? Knowing that my philosophy is, I'm a chiropractor, we make your body strong so the pain doesn't happen or goes away and stays away. We have to move, right? If we don't move, what happens? Remember what I said last time? If we don't move, what happens?
Atrophy.
What's that?
Atrophy?
What's the R word though? Rigor mortis. Right? Right? Rigor mortis kicks in. So you gotta move to avoid rigor mortis. All right? That's I try to bring it up once in a while, so it's fresh.
For me and you.
For all of us. For all of us. So when I see my patient for the first time, I ask them, where is the back pain? Some people say back pain is up here. Could be your side, could be your hip. I'm looking at back pain here in your lower back, right across the lower back. And like I said in the notes too, is it left or right? Why is that important? Does it happen only on this side when I get out of a chair, when I get up out of bed, whatever it might be, or is it across the back? Or in the center too? Because if it's one-sided, what happens when it's one-sided, sometimes I'll see on some, because I take x-rays in my office, is the hips will be shifted left or right. So back pain can happen because the hips are shifted because we have not a shorter leg, but we're just rotated left or right. Okay? So who wants Sylvia? Coming up. I need to demonstrate with you first. Okay? Other Sylvia. This, I'm going to go first. Sylvia 1, Sylvia 2. So go on your stomach for me, Sylvia. Go on your stomach, face down. Ooh. I know you can do it. I know you can do it. Not yet. No, that's later. So what happens with some people, if my hips are off, left or right, okay, and I have more pain, say, on my left, what can happen is sometimes that pain here can translate to look like what's called a shorter leg, meaning that here the legs might be not even. Hers actually is off a little bit, so you're off, Sylvia. What the heck? Thought I fixed you last time I saw you. So if I'm off here, if I'm shorter here on that left side, usually translates, not all the time, where the hip's going to be higher here. So that'll tell me someone has a higher hip like this, where I'm more twisted to my left than on my right. Okay, you guys see that okay? Okay? If I'm twisted, that means that hip's coming up, causing some pain. So my job as a chiropractor is help someone like this to get them more level here at the hips. So there's no rotation, there's no movement here. Also here, I want to see over time, can these feet stay more level to show that as being good, or like they're off right now, or can we get them to where they're more like this? Does that make sense? So back pain can come from left side, right side, or center. This is more if you're on your side to center. We'll go through that too. Thank you, Sylvia, coming up. I know, by someone important, I guess. Sylvia, here you go too.
By an orthopedist.
I'm bringing this back also. Silver star for you.
Oh,
Gold star for you. Bringing it back for 2024. COVID, I stopped it for a while. Okay. Another question on here too, as you see, is there neuropathy? Okay, what is neuropathy?
Numbness of the nerves.
It's when the nerves fire, causing back pain and or leg pain and or hip pain, even foot pain. Okay, neuropathy, what you would feel neuropathy would be burning, tingling, numbness, things like that. Even sharp pain. When you get out of a chair, you get up and go like this. You get up and go, oh, this grabbed me. Okay, that's shooting sharp pain. So you want to make sure if you have that, if that's going away, because if you want to stretch, you want to strengthen at a certain point, right? If you're at acute pain, acute neuropathy, you want to be careful with that. But if you know that's not a problem for you, green light to stretch. When patients come in the office, they have severe leg pain. Takes maybe a week or so to get the pain out of their leg. At that point, okay, let's start some stretching. Feels good? Start some strengthening. I want them as strong as possible, as soon as possible. Get the things better. Right? If you had it for a long time, they may say take some time to actually get better. That's the key. All right? So what is the low back roll stretch? Here is if I take, I'm going to use this. I didn't bring that with me today. Here, if I take just something that's circular, okay, I'm going to use, at home use more of a towel. I forgot my towel today. Here, you want to do is lie flat on your back all the way and take something like a rolled up bath towel, put in your lower back, and let that sit across the lower back just like that. That feels good. Then you want to do is bring your legs up like this. Okay? For how long should you do this for? How long you think you should do it for? 30 seconds to a minute, exactly. Okay? Because you want to do it long enough to where that, because you're stretching in these stretches, you're stretching ligaments in your spine, not the muscle on the outside. So you want to do it long enough so you have 30 seconds. Sometimes people are in severe pain to where they can't do 30 seconds. So we start low, it feels good, then go higher and higher and higher. So you want to take your time with these stretches. Again, this is not a race, right? There's no marathon coming up. So you have to get slow so you want to heal faster and get better. All right, so grab a seat wherever you can find a seat. There's some more chairs there. Sylvia will help you out. She's our coordinator for the day. Thank you, thank you, thank you. Right. So this one here too, I don't use my one because it opens up. Thank you, sir. So next one here too, if this feels good to you, the progression from the low back roll stretch, where you put something on your lower back, you can do it either on a mat, on the floor if you want. You can do it on I like the bed. It's simple, right? You're already in bed for one too. Okay. You can also do this one. You take that same roll with or without. Here, go to the edge of your bed, let your feet hang. I'll show you guys in a second over there too. Feet hang, and then from there, go all the way back. Okay? By doing that, you're using your legs, tension to let your back stretch even more to get that more of a pull on your lower back. Had someone try this today, same thing. They go, it's a little bit uncomfortable. I go, great, uncomfortable. That means you're causing a stretch. When you're stretching, you want to be uncomfortable because you cause a difference. Without that, it's not going to actually work very well at all. So you always want to stretch where it's uncomfortable, but not painful. Painful means that's just going to guard and tighten, make it worse. Okay, so you want to make sure in that range. So here, same thing here too. I'll just use this. From this side, legs on the edge. Let your legs hang on the edge of the bed. Dangle, then come all the way down. Slowly. That feels good to you with a rolled up back towel underneath. Then bring your arms above your head too. Allows more of a stretch of your overall body. Get that body to just decompress and open itself up. Okay. Any questions about that? Simple things, right? Yeah. But how often should we stretch? Every day. See, all my regulars, they always know. And I always tell my patients too, stretch the days that end with Y. Stretch the days that end with Y, which is every day ends with Y. So we want to make sure we do enough for our body every day because we're getting out of bed, we're moving around, we're lifting things up, we're cooking, we're cleaning, whatever it is too. We want to stretch every day as a routine. That's the plan, all right? Next one, here. So right now, if my next thing here is low back pain is on the left or right, we're going to add a hip flexor stretch, right? So it doesn't matter what side the pain's on your back. We want to make sure, again, we talked about a second ago with Sylvia, want to make sure that our hips, if they're off, that means tighter and weaker. We want them more even, okay? So you want to make sure we get them evenly balanced here and back here too. What you want to do, I'll go on both sides here, is here, go the edge, again, edge of your bed. We're going to use your bed as much as you need to. Here, go on the edge. Don't fall, because if you fall, don't blame me. Okay? Here, come all the way down. Bring your foot back behind as much as you can here, even more on your toe if you can also, to let that leg stretch out your thigh, hip flexor, and even your lower back here. Stretches all three areas. Okay? So again, it may be comfortable just to let your leg hang. I feel pretty tight here. Good, leave it alone. Okay? Feels easy. Bring your foot back as far as you want. Where it feels uncomfortable but not painful. How long should you hold the stretch for? How long, you think? 1 minute the most. Everything both sides. So here, same thing from this side too. We're going to go here. And you can switch sides better. What you in home. Come all the way down. Again, it feels good here. Let the foot just hang. If anything, bring that foot back as much as you can so it comes all the way back. Stretch out your whole thigh, hip flexor, and lower back at the same time. Because you're lying down, then the muscles can actually stretch more along with ligaments, because if I do it sitting up, there's not much of a stretch. Any questions about that? And when you're lying down, it's very hard to hurt your back lying down versus sitting up. You can actually twist. That hurts. Right? Any questions about that stretch? Nothing? No. 1 minute. 1 minute both sides. I would just do once. That's it. Just once. I would do twisting is tough because when you're standing up or sitting, all your upper body weight's on your body, and that load, that pressure can make that disc in your lower back or that spine kind of cause it to pinch or cause a spasm. So by lying down first, allowed to do by patients first, lying it down first allows to avoid that spasm, the risk of more injury. I don't want people mad at me, you know. Can't handle the emotional stress of someone being mad at me. Be tough.
After you lie down,
Yes.
you can stand up and twist.
You can, just be careful with it and see. Again, everyone's in a different situation, right? That point you can sit up here and just slowly turn your body. But you probably want to start doing it on your back first. That'll help. And then slowly get up. You always want to stretch if you can before you get out of bed. At that point you have a less chance of coming out of bed, getting up, and then causing back pain. So if you can stretch before you get out of bed, be the most effective way to do it. That's usually works the best for people. Because people have, especially if you're sleeping, you wake up like, man, back's pretty sore. You get out of bed, it's going to hurt a little bit. So stretch before you get out of bed. Get that pressure out of your back by stretching first. All right. Any questions yet? Pretty straightforward.
Yeah, that's what I do. I have to stretch before I get out of bed, or I don't move very well.
And when you have a routine of doing it every day,
Yeah.
then there's less chance of getting out of bed and then hurting yourself. People don't hurt themselves in bed. It's when they get out of bed. They get up. They take it to first step, third step. Boom, fall down.
It's that twisting and turning when we get out of bed.
That's that torque on your lower back got to be careful with. So I'd rather someone, it's on the list here, rather someone do this is when they're in bed, after they've done the stretches or this one too, sit there here for a second, then bring your knees to one side. This is your bonus one, not on the list. One side stretch, hold for 30 seconds to a minute, and then switch sides also. This allows your back to slowly stretch before you get out of bed so you don't turn and twist and hurt yourself. You have to call me at home and go, come and help me up. No. My wife would get mad. Where are you going again? Where are you going? All right, so next one. If the stretches feel good, and this is again my patients do, then there's no pain, no discomfort. You can move around normally. Then we add strength exercises. Again, why is strength important? Because if you're stronger, the pain can't come back. Very hard to come back unless you fall or something like that. If you fall, make sure no one sees you. Never happened. All right? So now, we want to stand and walk a certain way. We've done this before several times. You want to do, this isn't really flat, but I'll show you on here. You want to test your posture position. Okay? What causes most people's back pain? That is non-traumatic. What's the number one reason? Number one reason? Yes, bad posture. People stand like this all day long. Here, okay? Then they go brush your teeth, they go, my back hurt. It wasn't the toothbrush or toothpaste. It was because your back was going to go. So if we can get posture better first, once we feel good enough to walk a certain way, stand a certain way, that's better for you. A standard, if you want to call it that. What is standard posture? I'll show you here kind of. Is you want your heels against the wall, hips against the wall, and you want your shoulders and head against the wall also. A little bridge here, so that doesn't really count. I'll do it over here so it's easier to see. So same thing. You want your heels against the wall, hips, shoulder, and head people on this side over here, and stand there for about 10-15 seconds. Once you stand there long enough, then take a step forward. Try to keep the weight on your heels the whole time so we're here in your heels, not on our toes or midfoot. Because once you go on your toes and midfoot, if you can keep your weight on your heels, then the body relearns to set your posture here through your cerebellum, your brain, as your standard default balance. Okay, same thing over here. I'll go in this part of the wall. Here, heels, hips, shoulder, and head, all the way back. Hold for 15-20 seconds. Then come forward. Keep the weight on the heels the whole time so we stay back here, where at that point your body can rechange its position posture. When someone has bad posture, this easy to change back here. Is that easy? If they had it for a long time, you think, to stand back on your heels, is that going to be easy for them? Probably not. They go, man, it feels uncomfortable. It feels like I'm leaning too far back. I go, great. At that point, it tells me when I say great, your brain will now feel stressed a little bit because what's going on here? Causing that change, that uncomfortableness, again, we talked about earlier, but being uncomfortable allows your brain to rechange your balance point, your position, to make this your comfort over time. So when I walk this way, what I want to do is make sure I'm walking, this before too, is walking heel to toe the whole time. Head up if you can, if you're comfortable, heel to toe. At that point, our body relearns to stand, walk in better position here, instead of when we're going forward, we naturally want to stomp our feet or slide our feet. Okay, I tell my patients, I don't want to hear your feet in my office. Roll your feet. If you can roll your feet, head up, even hit your hand on the wall to touching the wall also to start your bounce initially, allows you to slowly retrain your brain again to make this your normal position and gait pattern while you're walking. Yes?
I noticed that I have been leaning forward now.
Okay.
My son keeps telling me, Mom, stand up straight.
Mm-hmm. Mm-hmm.
And I lean forward a lot, and in the mornings, my lower back is just killing me. And
Yeah.
it takes about 5 minutes, or after I'm up walking around, for it to go away. So is that the cause?
Exactly. All day long, your body's here. When your body's forward, now your body has to stress, your lower back has to stress so you don't fall forward. Your position here is making that lower back work too hard. By being up, then allows your body to use your hip muscles, your hip joints, your bones to hold your body back up. So come here for a second. I'll show you something. Is that okay?
Sure.
All right. So right over here, we'll use this easier to see. Right over here. And just stand with your heels as far back as you can. Hip, shoulder, and head against that wall. No, you're okay. Don't worry about that. Don't worry about it. Just right there, as far as you can, as far as you feel comfortable. Let your hands relax.
I'm going to fall forward if I let go.
No, you won't. No, you won't. You feel like you are, but you won't. What?
Okay.
That's the thing. When you have good position balance, your body goes, I'm not balanced. This is ideal normal. So take a step forward for me. Take a step forward. Keep the weight back here in your heels. I'll hold you so you don't fall. Does that feel weird?
Well, it feels like I'm leaning back.
Yeah, it feels like it's uncomfortable. So go back a little forward on your foot. Go a little forward. Right there. Does that feel okay?
No, now I feel like I'm falling forward.
So stay back on your heel as much as you can and slowly reset your body here. Give yourself time. So take a step forward. Go. Take left foot forward. Go on your heel. And now, got it. And now bring that foot down. Okay? Now bring that foot back, all the way back where it was. Now go the right foot. Nice and slow. Good. So now face me. Same thing. Hand on the wall, on the chalkboard, whatever it's called, driver's board. Left foot forward, go on your heel, and then drop your left foot flat. Okay, same thing. Bring that left foot back. Right heel forward. Drop the right foot flat. And then bring the right foot back. Were you looking down or looking straight ahead?
I was looking down.
Oh, now let's try it. Look, I knew you were. So now let's try it the other way. Now it's face that way. Now what we're going to do is do it with, now that you're looking forward at that corner of the wall. And now try it. Left foot forward on your heel. Good. And then bring that foot flat. And then go all the way back. Then right foot. Good. And then bring that foot back. What's your name?
Lydia.
Lydia? This is your homework every day.
Okay.
Okay? Against the wall first. Hold for 30 seconds. Okay? Then turn to one side. Left foot. Stop for a second. Bring that foot back. Right foot. Stop for a second. Bring that foot back. 5 times each way.
Okay.
So 20 total. Left, right, 5, 5. Switch sides. But look straight ahead too. You can watch the video later to remind yourself.
Okay. Yeah, because when I try to straighten up, I feel like I'm
Yeah.
leaning back.
It's resetting the posture. But using the wall with your fingers on the wall too helps you have the confidence, I can do it, because I'm not going to completely fall.
Okay.
All right, Lydia? Good. We do. Let's make sure. We don't, and one of my biggest classes that people want to see all the time is getting up off the floor and having better balance, right? Why is that important? We won't fall, and we want to be independent. If I fall, I can break my hip, my wrist, my ankle, my knee, my brain. Well, my brain's already broken, my wife says. I don't know. All right. We want to make sure we're doing things to help our body stay balanced and strong. Balanced and strong all the time. Being independent is the key for all of us. All of us. All right? So now, my last one for 1, 2 is called the kickback exercise. Okay, I'll move this out of the way so you can see it. Out of the way here. Okay, so what I want to do, I'll move in a second too. I want to do is make sure I use a wall here. If I feel I can walk, I have good balance, my exercises feel good, and I feel like, okay, what else can I do? My patient will ask, what else can I do? Okay, I want to now get this back stronger here, back meaning from here all the way, so say for example, right, the lower ribs, all the way down to right below my tailbone, right about here. That's what I consider the back. Okay, I want these muscles stronger. When they're stronger, should they pull you forward or pull you back, you think, when they're stronger? Back. Good. Majority rules type of thing, okay? We want to get these muscles stronger backwards. So you want to do is put your hands on the wall, whatever your comfortable balance here or wherever it's going to be, okay, on a wall. And what you want to do now is bring one foot up and just stay up on that toe, okay? Just like this, okay? If that's good for you, that feels comfortable, switch sides too, maybe for about 10 seconds on both sides. Hold there for 10 seconds, feels good. Then here, 10 seconds here too. Feels good, okay? No hip pain. What good means for me is no hip pain, no back pain, no leg pain. Okay, that's good for me. If that feels good, then progress to more of bringing that foot from on your toe to now off the floor. Hold that for about 5 seconds. Go back on your toe here. Flat foot, left foot. Then switch sides, right foot, right toe first. Bring that foot off the floor. Hold that for 5 seconds. And then go back to your starting point. About 5 times on each side over time. Again, if that doesn't cause any pain. Okay, so start on the toe first on both sides, and then progress to bringing the foot off the ground. Build up strength. That's the key. 5 times. Sure, you want to try this? Want to try it? Come up. Want to try it now? Yeah. Might as well. While you're here.
I want to make sure I was listening. Huh?
Good. I want to make sure. I know you were. What's your name? What's your name?
Madhur. It's M-A-D-H-E-R, Madhur.
Martyr. Okay. So good. Right there. Good. And then, so bring this. So good. Bring that. And what we're going to do now is bring your foot out here. Up. Hold it up.
That far. Okay.
I want to bring it up and bring it off the ground. There you go. Hold it right there. Where do you feel the tightness? Where does it feel tight? Does it feel tight in the back or does it feel tight on the leg?
Right here.
Perfect. Good. And then bring that toe back now, forward. And then switch to your left side now. Up on your toe first, right? Now come straight up from there. There we go. Let that knee come behind that knee too. Right there. There we go.
Yeah, now I feel the pressure.
In the back? Perfect. Because when you just bring your foot up, Martha, here, it's like, okay, it's more the leg. We want to bring that knee behind you more to let the stretch and get that back, to really contract that back. So at home, hold 10 seconds, 3 to 5 times on each side. There you go. Look at this strong guy. All right, my friend. Have a good day. Thank you. Any questions at all?
These are simple little things.
That you can do every day to maintain your balance and strength. Every day. I have other ones that have a bunch of them, doesn't matter to me. But it's something where can we do simple things every day so we can walk, stand, move, and be confident we're not going to fall, and we're going to have good balance. What happens if I'm doing the exercises too, Lydia, where I'm here and I'm going forward, right, heel to heel toe? I'm not going to fall forward, but what we also want to do too over time is start also walking backwards too on the wall with your eyes open. So when I walk backwards as a bonus from the list, at that point I'm training my body to maintain balance, not just with my vision, but also with my body, my body's nerves to work better too. You know, so you want to do this. I prefer to have people do it with their shoes off, so their feet actually feel the sensation of the floor, get the nerves to work better. The nerves are a living thing. When we move them more, they'll have more sensitivity. So can we do this with our feet? Either barefoot or if you want your shoes on too, it's up to you. At that point, even do it backwards, walking backwards. So at that point, we train our brains. So what happens is, hit something, hit the end of a curb, I'm not going to lose my balance completely. Whatever you can do to get your balance and maintain that balance and strength in your back, they work together. Because if I have a stronger back, we're going to have less back pain. If I do things every day, it allows me not to feel or have less of a risk of falling. Or getting out of a bed and going and calling Dr. Tony, okay, can I get in today? Because I messed my back up brushing my teeth. It wasn't a toothbrush. It was everything you're doing that caused that. What happened during COVID? What happened? We were all stuck at home, correct, during COVID? We sat a lot. We saw all the movies we thought we didn't see earlier. We saw them again because we forgot like I did. And I'm like, I watched that movie. No, I did watch that movie. It was a good movie. So at that point, we're sitting. We do what? When we sit, we do this. So what we want to do is making sure that we sit also to help our lower back stay strong, sit properly. And someone was talking about this earlier. We want to make sure, and I'll go on that side too, we're sitting with, if possible, if we sit like this, we want to make sure we're doing enough to sit with our feet underneath us, okay? If you can, knees below your hips. You want to have, and I tell people too from before also, the back of your chair is for what? What's the back of the chair for? Remember from a couple times ago? For looks, for decoration. Back of the chair. Stay off the back of the chair, stay forward. Keep your back arched a little bit so your balance is here in your hips, not on your tailbone. All right? Body here, knees below your hips. If you can, on your toes, if you can. If not, at least flat. So your body's more upright like you're standing. Just like that. So here, for the people in the front. Just like this. Boom. Knees below your hips, up on your toes, body up off the back of the chair. Boom. Okay? Same thing over here for the other seats. Same thing here. Underneath. Here, just like this. And then head up the whole time. Okay? Same thing here. And one thing too, when you sit, do you see, for example, the paper with your eyes or with your nose? Remember that from before? Before? So I have paper in front of me, right? Okay. So, weird question. What's this guy got all these weird questions for? Here, paper in front of me. Am I doing this? Okay, or I'm using because my vision is from here to here. Okay, my eyes. Or can I bring my head up a little bit, so looking more over my nose? What's better position, here or here? I want to be up. Can you use the bottom of your nose to look down on the paper versus with your eyes? Once I do this long enough, I start doing this. I start doing this. And I fall asleep. I usually do. Reading a book. 2 pages in, I'm out. It's usually me. Any other questions?
Well,
Yes, ma'am.
as all my friends know here, I have fallen 2 different times and broken each hip. I could not stop myself. And it was exactly for the right one first. I did the same thing for the left one. I went down. I could not control myself. Or figure out what to do not to break something as I was going down. And when I hit, nothing hurt. Each time, one hand here, the other time here,
Yeah.
I couldn't bring myself forward at all to catch myself. I just slid. The right foot went right out, and I just slid right down, slick as could be, and nothing hurt until I tried to get up. That was not nice. But yeah, I could have stayed in that position and nothing hurt. But
As long as you didn't move. Once you didn't move, you're okay.
yeah,
Yeah.
I didn't feel anything when I hit, but I could not figure out. And the second time I thought, okay, now there's got to be something
Yeah.
I can do here.
Okay.
But I just kept going back.
Playing ping pong.
Okay. Dangerous sport.
Well, it was just a little high, and I thought
Yeah.
maybe I could reach it, but I stepped out.
A for effort. A for effort.
I don't know,
Yeah.
if I had tried to follow a different way, it wouldn't have broke. But I have really good pictures of my hip,
Yeah.
my new hip, if anybody wants to see them.
They'll be on Facebook later.
That's the balance thing. The balance
Yeah.
thing is what.
It's the balance stuff. And when you're reaching, when you're doing a sport, for example, you go 100% sometimes. You don't think about it.
It just was so easy
Yeah.
and nothing hurt.
Yeah. Yeah.
She drove herself home.
Ugh.
Well, the
Yeah.
second time I drove myself.
Second.
And that's the thing is when we're doing something, we want to make sure it's as safe as possible.
The first time I had like three handsome big veterans help me up off the floor.
Dancing, swinging.
Ah, yeah, it's gonna happen. You know.
But
How's the recovery? How's the recovery from the hips? Do you have hip surgery? Did it replace it? Or
I
okay,
have the ball and
okay, yeah, the full hip
two
surgery.
middle hips.
Yeah.
She's got no more hips,
Yeah.
so she can't fall anymore.
Now she's bionic.
Well, he said that
Yeah.
there's no way he could, I may be in a wheelchair the rest of my life if I won't again.
Yeah, yeah,
This is scary.
yeah. And so,
Because he said he was just barely able
Fix
to.
it again.
and just making sure that we can do whatever we can to avoid that, or once you had it done, were you walking differently?
The last one was February 17th.
Okay, okay.
So I am just very careful. I have a walker in the house. I have grabbers all over the house.
Good, good, good.
I'm not I'm supposed to, use a pillow between my knees and everything.
Well, and from
I'm
surgery,
not supposed to cross my legs like a lady anywhere.
like this.
Right? Oh, you're not.
No, don't do this if you have hip surgery.
Oh, and
Don't do this.
I have to stay 90
This
degrees.
stops
I can't
blood
live.
circulation, you have strokes.
And when you have a full hip done, it takes almost 2-3 years for it to heal completely.
See that?
It just takes time. So whatever you can, don't do what she did. Don't play ping pong. Put a sign over there at the ping pong table to watch out for hip injuries.
They took the table.
Go, oh yeah, dancing. No, no.
And
He kept.
he swung her,
Yeah.
and they go.
Oh.
And then he fell on top of her. That was the first broken hip.
That doesn't sound. It sounds like they're gonna stop doing dancing completely now from the liability injuries.
Then she asked me for my ice cream.
Oh gosh.
I go, how are you doing?
Stories. Yes, ma'am.
On the, what was I gonna say now? It takes me a minute, I forget.
No problem. No problem. No problem.
What was I gonna tell you? Oh, when I'm standing up,
Mhm.
because I stand up and talk, visit with people a lot.
Yeah.
And all of a sudden, I can feel myself wanting to
Mhm.
go backwards, and I bothers me.
So,
What am I doing wrong?
what I would do is make sure you have to have good balance per se. If I have that issue where it's hard to maintain my balance standing, try to bend your knees a little bit more.
Oh, okay.
We talked about before in another workshop. To practice that also is taking a chair and just slowly coming down, hold, come back up. So if you're standing up too straight, at that point there's no give. So bend your knees a little bit. Even when you're standing, maybe even go on your heel and make your feet really flat, and go a little bit wider too.
I'm good at walking.
Yeah, so go a little bit wider, bend your knees a little bit to make sure you have a good wide center of gravity. That's the
I'm
key.
91 now.
Good, you'll be 93 in 2 years, I guess.
Yeah, and I do 100 in my hands every morning.
Every day. You have to move, people.
100 of this every morning.
Every day. Any questions? Anything else from the audience? We're good. Next month is what's tomorrow? Next month's talk?
Foot.
Knee and
Foot.
foot pain. Yeah.
Knee and foot pain. Okay, I'll figure something out for that.
What is stenosis?
Stenosis is where the canal closes off. So where the nerves are, the canal actually calcifies, so it's hard to get that. It puts pressure on the nerve completely.
On your tailbone or?
On your actually where the nerves come out of the spine, that canal, that hole where the nerve comes out of your back, for example, it becomes more narrowed. So it's a smaller diameter radius. Smaller diameter, right? It's a smaller circle.
Can
Yeah.
you do something to recover?
It depends. If it's calcified, no. If it's more because the bones are pushing together, you can get that space to open up if it's a disc issue to make the areas move more.
So if you drink vinegar, it's not gonna.
You'll just smell weird. You'll just smell weird, vinegar. I don't know. Helps other things.
What do you think about vinegar?
Vinegar's, it's,
Vinegar with everything.
I put vinegar on everything.
My grandmother loved to bathe herself or sponge bath in vinegar.
I know.
It's a great sanitizer.
Yeah.
Just not my thing.
Well, I've always
Not what I would do.
and now I've got all the girls, not all of them.
Yeah, they have
So
soap.
many of them they use.
Yeah. Hey, whatever works for you guys. It's a good sanitizer. If it entertains you, go ahead. That's what I people do. Anything else?
When you were talking
Yes.
about your balance, like if you backed up to
Mhm.
the curb,
Mhm.
is there any way to catch yourself when you do back up to the curb? That's how I fell. I backed up to the curb in front of my daughter's house and down I went. I couldn't catch myself no matter
If
what
you
I
can,
tried.
let your knees relax, your legs relax, and fall this way, so you're not falling straight back and hitting your head. And one thing is, when you fall, if you can, don't do this. Once you do this, it's called the phaeomass fracture. The wrist, the elbow, the shoulder, the clavicle. So if you're gonna fall, bend your knees and fall back. I don't want to demonstrate because it'll be entertaining for you, probably sore for me. I'll demonstrate, but bend your knees as much as you can and fall down this way, then fall backwards. Because when they feel stressed, they tighten up. Try to avoid that instinct and let your body relax into it. Yes, ma'am.
I fell about a year ago,
Mm.
and it was in the dark that day that it snowed.
Ugh. Yeah.
And I went to my side yard to bring in my plants so it wouldn't freeze.
Yeah.
And I didn't have a light there, and it was dark.
Yeah.
And when I fell, I mean, I was shocked because I didn't even have time to
Which is good.
catch myself.
Yeah.
I mean, I must have fallen flat like this,
Yeah.
flat on my face.
Ah. Okay. Face looks good though. Your face looks good.
Thank God.
Yeah.
Yeah, my teeth took me
Ah.
with it.
Okay. Which is sometimes good that you relaxed into it, or it caught you off guard versus doing this. So that'd be wrist, elbow, shoulder, clavicle. Any other questions, comments, concerns, jokes? You guys good? All right, I'll see you guys next month for the foot and knee exercises, because we all have feet, right? Let's get our feet healthy and strong. All right. You guys ever wear orthotics?